From the Toronto Star, I'm Raju Mudhar, and this matters. Do you have a family doctor? For an increasing number of Canadians, the answer is no. More than 6.5 million adults in Canada do not have a primary care provider, like a family doctor or nurse practitioner. That's more than 1 in 5 Canadians over the age of 18. We have all watched our healthcare system stretch close to its breaking point, but this gap of access to primary care is a huge problem that many experts say must be addressed. Megan Ogilvie is a health reporter at The Star and joins us to talk about the challenges people have finding doctors and the larger effect that is having on our healthcare system. Megan, thanks so much for coming back onto the show.
I'm happy to be here.
So Megan, let's start with the basics. What is primary care?
So in Canada, primary care is usually delivered by family doctors or nurse practitioners, and it really includes everything from well baby visits and childhood vaccinations to checkups for infections to scheduling your screening tests such as mammograms and colonoscopies. And when you need to see a specialist for surgery or you're dealing with a medical condition like cancer, it's going to be your primary care practitioner who helps coordinate that care in the system. Many of the experts I spoke to last week described primary care as the front door to our health system, and that's why it's so important to get it right.
We talked over the pandemic about emergency rooms being overwhelmed and other problems, but so many people don't have access to this front door of healthcare. How many Canadians don't have a family doctor?
Recent research has found that more than 6.5 million Canadians over the age of 18, so more than 1 in 5 adults, do not have a family doctor or a nurse practitioner. And the research that was conducted over the last year found that the problem was more pronounced in Quebec, BC, and the Atlantic provinces. But still, in Ontario, some 2.2 million folks aren't connected to a family doctor, and this is as of March 2022. And they found that that's up from about 1.8 million residents in March 2020. So we see in the first 2 years of the pandemic, the number of Ontario residents who don't have a family doctor really jumped up significantly.
And do we have any Toronto-specific numbers?
So new figures released last week showed that at least 415,000 Toronto residents don't have a family doctor. And again, that's as of March 2022. The data shows that, again, during the first 2 years of the pandemic, about 72,000 people lost access to their family doctor. We know that physicians across the province are retiring because they're either near retirement or past retirement, and some, because of pandemic stress, are choosing to close their practices or move to another profession. So the Toronto data that we wrote about last week really underscores the worsening state of primary care. And I think what most people noted that was most worrisome about the new figures, which comes from the Inspire Primary Healthcare Project, is that there's a pattern of inequity in who doesn't have a family doctor in the city. The data showed that a higher proportion of residents with the lowest incomes lacked a doctor compared to those with the high incomes. And on a map, that looked like neighborhoods in Toronto's West End and areas north of the downtown and Scarborough are the most affected by the discrepancy.
I want to talk a little bit about the inequity later, but I want to talk a little bit firstly about sort of the reasons here. Okay, the doctor retiring thing I get. I had my doctor, my GP, basically my entire life. So he was getting up there. And so I recently had to move to a new doctor, one that's not too far from me. But then the other thing too is that how are people accessing healthcare then if they don't have a primary care physician or nurse practitioner? Like, there's obviously gaps there. People are still getting sick. So where are they going?
So people are having to rely on walk-in clinics and hospital ERs and urgent care centers. And if you've seen the headlines over the last year, we know that each of these places, primarily hospital ERs, are seeing higher volumes of patients and longer waits. It's the lack of primary care is certainly not the only reason that that's the case, but I think it's an added pressure to a hospital system that's already overburdened. One person I spoke to for last week's story said his family was relying on walk-in clinics and pharmacies for sort of routine care like flu shots and COVID vaccines. And I think what the data shows that while people can get care in these places, it's really not continuity of care. And there's no one person who knows you or your family situation. And studies have shown that patients without access to primary care are more likely to land in the ER because their medical conditions haven't been caught and treated quickly. And without a primary care practitioner, it's much harder for patients to get that routine care like cancer screening or keeping up to date with vaccines. One of the nurse practitioners I spoke with last week said it this way, and I thought this was a really great quote. Not having access to primary care puts your health at risk. It puts your longevity of life at risk, puts you at greater risk of becoming more ill and needing more health services because your medical conditions aren't caught soon enough.
Okay, so the thing about this is that there were a bunch of reports that all pointed at this as being a big problem, which sort of says that we really have to deal with. Now, of course, we've laid it out. There's lots of people who are hearing this and going, yeah, I don't have a doctor. And, whenever I get sick, I got to go wherever I can to get it solved. But, okay, the Public Policy Forum released a report called Primary Care for Everyone, and it lays out sort of 10 steps policymakers must take to expand access to family doctors or nurse practitioners and make it much more equitable. What are some of these steps? What can we do to sort of improve the situation for everybody?
Yeah, I think that's the number one question everyone's trying to solve. And the report from the Public Policy Forum, which was authored by some of Canada's top healthcare leaders, really made the case for scaling up team-based primary care, which means patients are connected to interdisciplinary teams of health professionals, not just one family doctor. And evidence does suggest that this can improve patient outcomes. So for example, each team could have a dietitian, a physiotherapist, a social worker, or even a pharmacist, so that patients have all their care needs coordinated in one place. The report also set out some other steps, including national licensure of physicians, so doctors can move more freely across the country, maybe to areas that are most in need. The report advocated for cutting the administrative load for physicians so they can see more patients in a day. I think in Ontario, the Ontario College of Family Physicians has said that the average doctor spends about 19 hours a week just doing admin work. And that really eats into the time they can see a patient face to face. And the Public Policy Forum also said that they're recommending measuring, tracking, and reporting how well Canada is doing in closing the gap on the family physicians shortage. They say that the public deserves to know how their government is doing on this because it's so important to all of us. And they also say that what doesn't get measured can't get better managed.
We'll be right back. Okay, the federal government just had a massive budget and there was a bunch of money in there for healthcare. Was this one of the focuses of the healthcare spending in that plan?
Yeah, the federal government's recent deal for health spending, which was a lot of back and forth negotiations over the winter between the federal government and the provinces and territories, that deal actually did highlight primary care as a priority area. And in conversation with the Star's Althea Raj, the federal health minister said that the government has provided enough money to ensure every Canadian has access to family medicine. So the governments have stated that this is their priority. The provinces and territories have also indicated that shoring up primary care is something that they want to do. Some of the experts I've spoken to in recent months have said that while the money is welcome, by itself, it won't be enough to get us there. And so new strategies like what the recent reports have been saying, we need to reform primary care, not just better fund it. So every Canadian is connected to a family doctor or a nurse practitioner.
Okay, like I said, so we have dueling reports here all talking about the same sort of thing. And so there was also a report from Our Care, which looked at sort of the Ontario's primary care system, and it had a number of recommendations and improvements as well. What did that say?
Yeah, this one was really interesting because it might be the first, but it's definitely one of the first reports where everyday people are making the recommendations. It's not healthcare experts. The Our Care project, it's a national research project that is gathering public input on how to reform primary care. It's led by Dr. Tara Kieran at St. Michael's Hospital here in Toronto, and she says that patient voices must be part of primary care reform. And so last week, Our Care released its report for Ontario, and it's based on the voices of 35 everyday Ontarians. The panel was randomly selected from more than 1,250 volunteers to represent the demographics of the province, and more weight was given to equity-seeking groups. This panel spent 39 hours learning about primary care, and then they developed their own recommendations. What would they like to see Ontario's health system do for family medicine?
And what kind of stuff do they want to see? What kind of recommendations came out of it?
Yeah, so for reporting on the story, I got to speak with Dr. Kieran, who led the report. I also spoke to one of the 35 panelists, the everyday Ontarians, and both of them told me that the idea of this team-based care was really attractive. the idea that your foundational primary care would be handled by a group of healthcare experts, not just one doctor. They like the idea that you'd be surrounded by a team of professionals, not just a solo family doctor. And the interesting idea that came out of that was something that's been gaining traction, I think, in recent months. The panel of residents or patients advocated for a geographic model of primary care. The idea here is that residents are automatically connected to a family doctor in their neighborhood, somewhere within a 30-minute drive from where you live or work. And it's like how children have the right to be automatically registered at their local public school when they move into a neighborhood. You're not searching for your family doctor. When your family doctor retires and you get dropped, you're not on your own trying to find someone who has space in their practice for you, or you're not waitlisted, that you are, wherever you live, you will find primary care.
I was going to ask you about that automatic rostering idea and linking to your location. This sounds like a fantastic idea to me. I mean, I know that there was a lot of money in that budget, and this government believes that there should be enough resources for every Canadian to have access to a doctor or a nurse practitioner. But I'm not sure if the federal health minister has tried to find a doctor recently, because it's really hard. There are wait lists, and there are so many that just aren't taking new patients. So that would solve one big problem. But the other thing that I want to talk about is something that you touched on earlier, and that's the idea of equity. All this data points to the fact that the most vulnerable people, like those with lower incomes, are likely to be the ones that don't have easy access to primary care, right?
Yes, exactly. And I think what you said a bit earlier, if you say many of us recently had to find our own family doctors, we know that it takes a lot of work, it takes a lot of time, and many of our vulnerable populations may not have that same access to technology that would help us get to a family doctor, doesn't have the same privilege of time to have that work to find a family doctor. And so, as you said, both reports that I recently wrote about highlighted or stressed the need for equity and primary care reform. The citizen-led panel, the group of 35 regular Ontarians who came up with their own recommendations, really made equity sort of the foundational block for their suite of recommendations. Dr. Kieran said that they really stressed the vision of everyone deserving access to primary care, and that reform must acknowledge that some populations have historically lacked access. And these are such as newcomers to Canada, those who live in rural and northern Ontario, Black Canadians, and Indigenous communities. Once you acknowledge that we have to be equitable, then we can do better. Here's another really great quote from Dr. Kieran. She said, "These citizens together put forward a vision to change the system so it works for everyone. They're thinking not just about themselves, but their families, their communities, and the system." So I think what that shows is that many people in the public realize that primary care works best when it works for all of us. And this panel of folks have said that they want a family doctor for themselves, but they also want family doctors for their community.
Okay, this is one of these things where I don't want to be too skeptical, but like this whole team-based approach, like this sounds like a geographic sort of structuring type of thing. This sounds like pretty crazy ideas because it would require some real reform of how we do this sort of stuff. And I can see some doctors perhaps not to go along with it, considering if they've been doing it for a long time the way that they have. Well, that said, all this data points to the problem. Is there anything concrete that we can start to point to as sort of positive developments in this arena?
It's a great question, and it's a question I've put to a lot of the experts I've recently spoken with. As you say, this is not an easy task, but each of the experts said they do have reasons for hope because the lack of primary care and the stress on the hospital system has been so prevalent in the last few years. We all understand that more needs to be done for our healthcare system. So the challenges have been clearly set out. And it seems that the government at each level is responding to those challenges, both in money, clear investments in primary care and stating clearly it's an area of priority to reform. And then the experts say because set out the challenges and the governments have indicated that this is a priority, we can now, the public, can pay attention and have a voice in what we want. So some of the people I spoke to really encouraged people to let their government officials know that primary care has to continue to be a priority, that they can start to say what they want. If the idea of a team-based approach or the geographic automatic rostering in geographic neighborhoods is something that's appealing, ask your governments for it because we can help continue to make a priority.
Megan, this has been fantastic for us. I really want to thank you for your time today.
Thanks for having me. It's a really important topic to talk about.
Megan Ogilvie is a health reporter at The Star. That's it for today. Thanks so much for joining us. I'm your host, Raju Mudhar. We want to hear what stories matter to you. Please send us comments, questions, or ideas to to This Matters at thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com/subscribing matters. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.